my name is Dr. Linda Stevens, the owner of Stevens Family Chiropractic. Today we're going to talk about sciatica and low back pain. And I brought the model so that we can actually look at where the sciatic nerve comes out and why people get the type of pain they get. So first of all, with the spine we have the lower segments L4 and L5 and then into the sacrum. They're all going to come out into one big nerve, which is the sciatic nerve. And that goes all the way down the leg. It goes down the outer part of the leg and the back of the leg, all the way to the top of the foot and the bottom of the foot. So when somebody says they have sciatica, they don't always have the pain going all the way down. They could get it just to the buttock area. They could get it just in the upper part of the back of the leg, or they can get it all the way down. It doesn't necessarily mean that they have a herniated disc or a bulging disc. That is one of the reasons why we can get sciatica, but more often than not, it's because they have a subluxation in one of these areas, L4, L5, the sacrum, and or the pelvis. So any of these areas can misalign, and what happens is when they come out of alignment, they get inflammation and irritation around that nerve. Depends on how much out of alignment it is and how long it's been going on, and certain positions can make it worse. So when they get that impingement on the nerve, it's mostly the inflammation in that area that's causing it. And what we need to do is actually get the bone pushed back into position so that it can begin the healing process, the inflammation to go down, and then they'll start to see that their symptoms start to subside over time. And usually pretty quick. I'll tell people sometimes 3 to 6 treatments, sometimes it's more, sometimes it's less. It depends on how much the irritation is and how long they've had the problem. There's also another condition called piriformis syndrome. There's a muscle that sits over this area, and the nerve comes out through that area too, or underneath it. And that can also cause sciatic pain. We don't see that a whole lot, but it is one of the conditions that causes it. Now, that can also be because there's a misalignment that's causing the muscle to be tight, and they have pain through that area. But we know how they're going to do within the first few treatments. And if they're not responding, let's say in 2 weeks they're still having a lot of pain, then of course we're going to go ahead and refer out for an MRI. The MRI will tell us if they have a bulging or herniated disc, and even if they do, it doesn't mean that they can't be adjusted. It just means that we know exactly where the problem's coming from. Again, being more specific, just like we do with our x-rays, which we're always going to look at those first before we adjust. And then if we need to make a referral, we will make a referral out, but 99% of the time, most people will respond with the chiropractic adjustment.